I got to get your thoughts, if we could, on this potential transaction between Microsoft and TikTok. If you were running Microsoft today, would you want to buy this company?
I think it's an exciting I say this as the shareholder at this stage. I think it's an exciting proposition for Microsoft. Obviously, it depends on the price. Price is important, and as well as whatever restrictions come with it from a government perspective. But I think it's an exciting avenue for Microsoft to really increase its consumer base.
Let me ask you, as somebody who has bought consumer businesses before, and Microsoft has, I think it's fair to say, a mixed record on some of the consumer businesses it's been. I'm thinking of Bing, obviously, the Nokia transaction. On the other end, Xbox has been a wild success. Minecraft has been a wild success. How do you see this playing out for Microsoft, which has done so well recently by focusing, frankly, on the business enterprise consumer?
Well, I think, as you point out, there's successes and failures in the consumer business. And I think it's important to remember, you've got to...
And what a weekend of developments regarding Microsoft.
Look, I think Microsoft was the laggard. And if you recall, people did not like the quarter, which I thought was silly because Satya really did deliver. But now we have something that puts them right in league, if not passing, in terms of the growth, Google and Facebook among a certain demographic that people really want. Which is the which is the 18-year-old demographic. I go on TikTok and I'm off in a stand. There's a good one right now about Federal Express delivering packages versus UPS versus the post office. But, David, your kids may like it. I find it soporific. At the same time, it's got a lot of viewers.
It does. 80 million MAUs here in the States. Yes, one of mine does. Typically, it does skew more female than male, and the other one doesn't. But this is a fascinating situation, guys, for any number of reasons. And unlike anything that I can recall having seen, in part because the government is so deeply involved in basically dictating the potential sale of a business to one company. And it really ends up being one company. You know, as you guys know, I've been following this to a large extent over the last few weeks. And it was a difficult thing to imagine. How would ByteDance go about disposing of this business?
What we need to do to prepare. And I want to remind everybody that it is the same approach that has worked time and time again. New Yorkers looking out for each other is crucial in a situation like this. So what do we have? We have a storm that will start late tonight with heavy rains, high winds, and coastal flooding. Now, at this moment, I'm going to emphasize this, at this moment, from what we've heard from the National Weather Service, the impact appears to be limited in terms of New York City. But, my friends, we have been surprised before by storms. We've been surprised by the way they can change at the last minute. So we're in a very vigilant state right now. We are not taking any chances at all. And for everyone who lived through Hurricane Sandy, you will remember that we got a lot more than we bargained for. And we've seen that with snowstorms as well. We want to make sure we're always ready, no matter what last-minute shifts in a storm. And we're particularly concerned about areas that are vulnerable based on the projections we have now. Lower Manhattan is particularly vulnerable in this situation based on what we've heard from the National Weather Service. So, emergency management is deploying interim flood protection measures. Now, these are the kinds of approaches that we learned the hard way with Sandy that we needed to have ready. We've made a lot of big, major investments, but we also need temporary measures that you can put up in a matter of days when...
Now we have the latest on the coronavirus emergency and that message from Dr. Deborah Birx that we are in a, quote, new phase, with the virus now extraordinarily widespread, and urging people to take more precautions as the number of confirmed cases rises. California becoming the first state to surpass 500,000 cases. The U.S. now reporting more than 4.6 million cases. Victor Oquendo is tracking the situation from Miami. Good morning, Victor.
Good morning, Robin. Florida is right on California's heels, set to top that 500,000 case mark within the coming days. Statewide, less than 20% of ICU space is available. Here at South Miami Hospital, the ICU is at capacity. But we start with that warning from Dr. Birx, urging those who live in a home with people who might be more at risk to consider wearing a mask indoors.
Urgent words from White House Task Force Dr. Deborah Birx saying that the U.S. has entered a new phase of its battle with the pandemic.
I want to be very clear. What we're seeing today is different from March and April. It is extraordinarily widespread. It's into the rural as equal urban areas. And to everybody who lives in a rural area, you are not immune or protected from this virus. And that's why we keep saying no matter where you live in America, you need to wear a mask and socially distance.
The CDC now predicting the number of lives lost to the virus in America could cross 180,000 in less than 3 weeks. In New Jersey, where transmission rates are soaring after weeks on the decline and new hotspots are emerging, officials are outraged.
Everyone who walks around refusing to wear a mask, or who hosts an indoor house party, or who overstuffs a boat is directly contributing to these increases. This has to stop, and it has to stop now.
This weekend, officials in New York arrested the owner and captains of a party boat called the Liberty Bell, claiming they did not practice social distancing. As the battle over schools rages on, Louisiana announcing that of the nearly 3,500 new cases reported since Friday, 10% are children under the age of 18. 33% are between 18 and 29-year-olds. This weekend, 27-year-old Red Sox pitcher Eduardo Rodriguez announced he's sitting out the rest of the season. He was diagnosed with myocarditis, an inflammation of the heart, which the team believes is a result of COVID. 29-year-old Joshua Elbaz lost his father to the virus last week. Now he's in a hospital bed in Georgia, trying to fight it off as well.
You don't think that it's real? Look at me. I'm in the hospital right now, hooked on oxygen. And my dad just died.
COVID-19 also claiming the livelihoods of many Americans. Lynette Hale ran a daycare in Colorado. She says COVID cleared out business and she can no longer afford her home.
I'm 70 years old and I'm about to be on the street.
What are you going to do?
I don't know.
And new this morning, pharma company Eli Lilly announcing it has started the final stage of testing monoclonal antibodies, a manufactured drug which it hopes will offer short-term immunity to patients, which could be used as a bridge until a vaccine is approved.
We know from preclinical experimentation that the antibody has the potential to block transmission of the disease. In other words, if we give it to an individual, we're testing to see whether they're now protected from getting infected with the virus.
That Eli Lilly trial is unique. It's essentially a mobile clinical trial going door to door at nursing homes. They've already started administering the antibodies to seniors at one facility in Illinois. George?
Okay, Victor, thanks very much.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.